Blowing up a balloon can help sinus sufferers get precious air into their own lungs. It's an alternative to traditional surgery that can speed recovery. In today's cover story, Rod Starnes explains how a new technology allows doctors to use a tiny balloon to solve sinus problems.
Bryant Wilkinson moves to the basket with ease. He's been working on his game since he was little, but for a while it wasn't so simple. Bryant was one of 37 million Americans suffering from sinusitis, inflamed sinuses that result from infection. The condition is more common than diabetes, coronary heart disease, or asthma. And according to Bryant's dad, it led to an even more serious problem.
He had strep throat. We were having it probably once a month for probably 6 to 8 months. And as soon as he would get through with one over the antibiotics, it would start back and he'd get strep throat again. So it just kept going on, and we had to come up with a solution that we couldn't keep him on antibiotics forever. And so we had to come up with a solution to take care of the strep throat.
When the condition doesn't go away, doctors call it chronic sinusitis. In Bryant's situation, that meant recurring strep throat. For other sufferers, it can cause throbbing facial pain and headaches, difficulty breathing and sleeping, even a reduced sense of taste.
It slowed me down at least a step or two, so when I would try to drive, they would beat me there.
That was very much a big part of it. When he was running up and down the court, you could see the trouble he was having breathing on his face. I mean, you could see him turning red-faced, and just hard, breathing through his mouth instead of through his nose like you should.
Chronic sinusitis afflicts about 7 million of the Americans with sinusitis. Treatments include antibiotics, like Bryant was getting, but can include other medicines, such as nasal or oral steroids. There are surgical options when medication doesn't work, which involve removing tissue and bone. The Wilkinsons worried that surgery would mean a lengthy absence from the basketball court.
I really didn't think there was anything that could help me, truthfully. But when we found Miss Lim, it helped.
Dr. Victoria Lim, an ear, nose, and throat specialist who helped Baptist Memorial Hospital DeSoto become a center for sinus excellence this year, suggested a less invasive procedure called balloon sinuplasty.
Basically what it is you use a balloon catheter to gently dilate open the natural opening to the sinuses, thereby leading to a safer but yet effective way to treat the sinuses.
The balloon system doesn't remove tissue or bone, unlike surgery, which increases the possibility of scar tissue forming inside the sinuses. In this animation, you can see that the balloon expands inside the sinus, pushing the walls of the sinuses back into a more open position. The balloon sinuplasty procedure is based on balloon angioplasty. That's when cardiologists thread tiny balloons inside the body to push open blood vessels blocked by plaque. But there is a drawback to balloon angioplasty. At times, blood vessels will close up or reblock, requiring doctors to use tiny metal tubes called stents to keep them open. That isn't necessary in sinuplasty, according to Dr. Lim.
It is different because when you open up the natural opening to the sinuses, you are actually microfracturing the bone surrounding the sinus opening. So that bone, when it heals, will heal open, and so it actually stents it open itself. And you don't have to leave anything behind in that area because as the bone heals, it will actually stay open.
Balloon sinuplasty can be done in a hospital under general anesthesia or in a doctor's office. Dr. Lim says it's amazingly effective for young children with sinusitis and is, in her view, the safest way to treat children's sinuses. Out of 500,000 procedures performed so far on adults and children in the U.S., Dr. Lim says there have been that's zero, adverse effects or complications. The recovery time is quick, usually a couple of weeks, and that translated into a quicker game on the court for Bryant.
It got me a few more steps, so it really helped out a lot.
For Smart Medicine, I'm Rod Starnes.